let's talk about something that's so important for so many of us, but often goes undiscussed: vaginal wellness. We're going to cut through all the noise and get right to the heart of what expert-led care really looks like.
So, maybe you're starting to notice some changes down there. It could be after having a baby, or maybe it's part of the journey into menopause. Whatever it is, if you're wondering what's going on and what you can do about it, you are definitely not alone. And when it comes to your own body, you know deep down that a quick fix is never the real answer. What you're really after is credible, professional, and compassionate guidance that actually leads to results that last. So, let's get into it.
To really understand this topic, we need a guide we can trust. And the expert whose philosophy and experience we're drawing from today is the wonderful Dr. Farzana Khan.
And this quote, it's really the core of her entire approach. It's all about making sure you understand what's happening, you know what to realistically expect, and that you're an active partner in making decisions about your own health. It's empowering, as it should be.
Dr. Khan brings just a massive amount of experience to the table. We're talking over 20 years. After getting her medical degree, she went on to specialize in sexual and reproductive health. And today, she's not just treating patients. She's actually a trainer for other top clinicians in the field. That really tells you everything you need to know about her level of expertise.
Okay, so let's talk about the specific concerns that bring women to seek this kind of care. And I want to say this again because it's so important. These experiences are incredibly common. And look at the range of issues we're talking about. It covers things like stress, urinary incontinence. You know, that little leak when you cough, laugh, or jump. It also helps with vaginal dryness and atrophy, which so many women experience during menopause and can make intercourse painful. Plus, it addresses the physical changes that happen after childbirth and can even be a powerful treatment for tough inflammatory conditions like lichen sclerosis. It's a really comprehensive approach.
So, what is the actual solution here? Well, what's so amazing about it is that it's not about adding foreign chemicals or anything like that. The whole idea is to harness your body's own built-in healing power. It's incredible, really.
But that's the million-dollar question, isn't it? It sounds great, but how? What's happening on a biological level that makes this work? Let's break it down.
Okay, so here's the secret sauce. The treatment, whether it's a laser or a radiofrequency, creates a tiny, controlled micro-injury to the tissue. Now, don't let that word scare you. It's not damaging. It's more like a signal, a little tap on the shoulder that tells your body, hey, time to send in the repair crew. And that's exactly what it does.
And this just lays it out perfectly. Step 1, you stimulate the tissue. Step 2, your body's natural healing response kicks into high gear. Blood flow increases, and these amazing little cells called fibroblasts get to work. And step 3, those fibroblasts start building brand new collagen and elastin, the very things that make your tissue healthy, thick, and strong again.
The science is one thing, but what does this all mean for you as a patient? What does the journey actually feel like? Let's walk through the whole process so you know exactly what to expect.
First off, this isn't a one-and-done kind of thing. A standard treatment course is typically 3 sessions. Think of it like building something. The first session lays the foundation, the second one builds up the structure, and the third one really solidifies all that great new tissue.
And the timing is really deliberate. You space those sessions about 4 to 6 weeks apart. Why? Because your body needs that time to do its job, to heal, repair, and remodel the tissue. You can't rush biology. You have to work with its natural rhythm.
Of course, this is what everybody wants to know, right? When am I going to start feeling and seeing the benefits of all this?
And the most important word here is gradual. It's not like flipping a switch. A lot of women start to notice a real difference after the second session, but the magic is still happening behind the scenes. The peak results, the absolute best outcome, usually show up about 2 to 3 months after you've finished your very last session. So a little patience goes a long way.
This is such a common question, and it's a really important one. People wonder, hey, can I just try one session and see how it goes? And the straight answer is, not really. For the kind of deep, meaningful tissue remodeling that gives you results that actually last, you've got to commit to the full course. One session just isn't enough to kickstart that powerful, long-term healing process.
Okay, so you've done it. You've completed the initial course, and you're feeling fantastic. The obvious next question is, how long does this last? Let's talk about keeping those great results.
So, on average, you can expect these amazing results to last for about 12 to 18 months. I mean, think about that. A year and a half of relief from symptoms that might have been bothering you for ages. It can be absolutely life-changing. But it's important to be realistic. It's not a permanent fix because our bodies are always changing.
The best way to think about it is in two phases. First, you have the initial phase. That's the course of 2 to 3 sessions that does all the heavy lifting to build up that new collagen. Then, you move into the maintenance phase. This is basically an optional, single top-up session once a year to keep everything in great shape as your body continues its natural aging process.
And this table just makes it super clear. For treatments like vaginal laser or radiofrequency, that annual top-up is the way to go. Same for other regenerative treatments like the O-shot. What's really interesting is when you compare it to something like pelvic floor physiotherapy. Now, physiotherapy is fantastic, but it requires constant work, a few times a week, forever, to maintain the benefits. With this regenerative approach, you do the work up front, and then it's just a simple annual visit.
So, as we wrap up, what are the most important things to take away from all this? Number 1, expert guidance is everything. This is not something to DIY. Number 2, remember that this is a process, not a magic wand. You're working with your body. 3, the results are incredible, but you need a simple maintenance plan to keep them. And finally, number 4, this is all about you. A personalized plan is the only way to get the results you're looking for.
You know, the goal here wasn't to give you every single answer, but to empower you with the right information and the right questions to ask. Now that you understand how it works, what the journey is like, and the importance of long-term care, the real question is, are you ready to take that next step and make a truly informed choice for your own health and wellness?